Hello, everybody. So what we're going to do today is, I know some of you have been sitting through the U.S. benefits piece delivered through my colleagues. We're going to shift our focus now to Canada. So for those of you that don't have Canadian employees, feel free to take the next 30 minutes, take a break. For the rest of you, welcome. My name is Faisal Mitha. I'm the Chief Innovation and Sales Officer for Hub Canada on the employee benefits side. My background involves 15 years of experience, and I've had the privilege to work with some really high-profile clients across Canada. And then prior to that, I was underwriting with two of Canada's largest insurers. The purpose of our time together today is to provide you with some tangible strategies to consider for your employee benefits amidst the changing landscape that we all find ourselves in. So our journey today really will focus on four key areas. The first one is budgeting, things to consider for your renewal as you come up to your 2020-2021 budgeting. From there, we'll move on to plan design, ranging from immediate cost relief ideas all the way to greater investment in employee support, which we'll find that we need. Speaking of employee support, we'll talk about how you can use benefits as a means to support bringing employees back to work as they come into the new normal. And then from there, we'll close it off with virtual services. So let's get into budgeting. So really what I wanted to do here was lay out some factors for you so that you can confidently enter into your 2020-2021 budgeting exercise with your advisor. So these are some key data points to have available and have as part of your discussion. The first area is really around employee numbers. How have your employee numbers shifted today versus where they were pre-COVID? Have there been temporary layoffs? And if there have been temporary layoffs, have you extended benefits? Those are some key considerations to talk about with your advisor on because they will impact your renewal. From there, we jump into funding method. So there's basically three different types of funding methods in Canada. There's fully insured, which a lot of small and mid-sized employers take part in. There's ASO, it stands for Administrative Services Only, and it's essentially a self-funded way to fund health and dental benefits, which a lot of mid and large employers take part in. And then there's also refund and retention accounting, which also a large group of employers do as well. From benchmarking data, we found that the majority of employers kind of gravitate between fully insured and ASO, so I'll focus my time there. On the claims breakdown side, really critical for you to have a sense for what your dental claims look like as a whole, what your paramedical claims have looked like both historically and trended towards this year, as well as your mental health-oriented claims. In terms of medications, psychology, usage, disability claims, and employee assistance plan data. These data points will be important, not just from a pricing standpoint, but also to give you a sense for employee health and areas to focus on as things are shifting. Included in the claims data points are also short and long-term absences. So prior to COVID, 1 out of every 3 claims were already mental health related. And those claims are by nature longer duration. They tend to last longer. They're more difficult to bring back to work. And what we saw in the financial crisis in 2008 was there was a greater incidence of mental health-oriented claims, which we do anticipate to play out again going forward. We'll talk a little bit later about manager training to kind of help in this support mechanism a little bit later. The next piece is around experience period. So the experience period is that period of time that you'll see in your renewal that the insurers use to calculate your premiums and claims. So it's usually a 12-month period, but it could gravitate a little bit. The timing of that period is really critical. So why is that timing critical? Well, essentially what happened in the landscape that we find ourselves in is from March to June, there was a large drop-off in claims for dental and for paramedical practitioners because those offices were closed and there was nowhere to get those services. So for those of you that might have an experience period that's June 2019 to May 2020, well, you're going to have an exemplary claims year because 3 of your 12 months will have a drop-off in some major claim categories. That same claims experience put into a client that has an experience period of December 2019 to November 2020 will have a lot less disruption because after May and June, as things start to normalize again, that 12-month period will be relatively stable. So your experience period really matters, important to discuss with your advisor. And then last but not least, for those of you that are on ASO, really critical to monitor your monthly statement and to make sure that your surplus is sufficient. So let's jump into pricing by benefit line. So we'll really focus on the three areas that have the predominant costs, which are disability, healthcare, and dental. On the disability side, group composition matters. Really critical to take note of how has your group changed relative to what it was pre-COVID and what relative to what it was last year. Has your average age shifted at all? What's your distribution of white collar to blue collar employees? Those are some things to consider because that will impact your pricing going forward. For those of you that have over 500 employees in your Canadian plan, you have what we would call is credible claims experience. So the insurer will essentially take your claims experience in determining the rates for your renewal going forward. So it's really important to get a sense for how your own claims incidence and how your own claims duration has shifted, if at all, during COVID relative to what it's been in the past. What we found is, in talking to insurers, is that duration has been an issue because although insurers are ready to work with an employee to get back to work, there haven't necessarily been positions for that employee to come back into. So that's really stretched out the claims duration period. For those of you that have less than 500 employees, it's less about your own claims experience and really more about your insurer pricing methodology. So what insurers do here is they take their morbidity tables and they make adjustments for things like your industry, occupations covered, demographics, as well as interest rates, which really help them earn a return on their reserves. We've already started seeing adjustments from insurers in pricing methodology, and that was happening pre-COVID. So we expect that will only intensify going forward. What's really important to note here as an employer is that most plans, based on our benchmarking data, have disability set up as an employee paid benefit. So it's really going to be critical around renewal time to give yourself enough time to communicate potential LTD rate changes with your employees and plan around that. So let's move into healthcare. So with healthcare, a couple of points I really wanted to focus on. The first one being funding method. So for those of you that are ASO or self-funded, you essentially control your own destiny for pricing. The thing to note here is what I've realized over the last year is that some companies are keeping a very tight reserve of only 4 weeks in their account. I would suggest that's not really sufficient for the volatility that we're expecting ahead as claims start to ramp up. So I would encourage you to look at potentially 6 to 8 weeks minimum to tackle fluctuations for the next several months. Because a lot of clients that I've looked at, they've taken a premium holiday on their ASO account. So they've already started to dwindle that reserve a little bit. So it's something to keep an eye on. For those of you that are insured, your renewal is really going to be based on a ratio of what your claims are over what your premium is. So with that being said, something to note is many insurers have offered a premium credit ranging from 0 to 10% on healthcare and 30 to 65% on dental. So we know that claims have come down because dental and paramedical offices are closed. But what they also did is they gave you a break initially on the premium side of it. So you won't see that, that cost differential play into your renewal. They gave you that savings in advance. So that's something to keep in mind. For those of you that have also requested a premium deferral, it's really important that premium deferral get reconciled as you get to the renewal, because otherwise what will happen is that the premium part of that equation will become even lower. So it's really critical that you reconcile premium deferral if you can, and that'll really stabilize your renewal as well. The other thing to note is on the paramedical side, so monitoring your claims. What I've seen in the past is that paramedical claims comprise 15 to 65% of overall healthcare claims. The question is, where do you fit in? Because you will see a reduction in those claims. Paramedical offices like massage therapists and chiropractors, for example, they have opened up in some provinces and they will open up relatively soon in every province. But it's going to take them some time to settle into the new environment. So it's going to take a while for those claims to ramp up to what they were in the past. The other thing that you might notice is that I haven't mentioned COVID medications here at all. The reason for that is, unlike in the US, in Canada, all of those are administered in the hospital and they're covered by the provincial healthcare programs. So there's no impact yet on private plans, and there's no impact on hospital claims either, because that's also been picked up by the provinces. Jumping into the dental side, for dental, we basically saw a near elimination of claims from March to May as dental offices closed to non-emergency care. What we found with the provinces that have allowed the dentists to open up is that dental offices are still sorting through the new reality and trying to find mechanisms for safety for both their patients and their staff. And with the shortage in personal protective equipment, it's going to take them a while to be able to deal with all the pent-up demand for dental services. So what we do anticipate is that you're not going to see a spike necessarily in June or July. Those pent-up claims that you've had will take several months to kind of play out over the course of the year. But this is where and why your renewal experience period really matters so much, as I explained earlier. So with that being said, on the pricing and budgeting side, let's take a deep breath. Let's move beyond pricing and shift our focus on plan design. So essentially with plan design, the primary driver for your costs and your premiums is really your claims. Claims are the majority driver. It doesn't matter what size of an employer that you are. So the key thing to note here is, what are the drivers that are bringing claims forward? There's three that I've identified there, out of which only one of them you can actually address in the short term, and that's your plan design. So the key thing to consider here as an employer is, how do you use that plan design lever in a manner that aligns with your strategy and minimizes the negative impact on employees? So we'll talk about some specific plan design measures to consider later in the presentation. Before we do that, I wanted to talk to you really briefly about one cost that you can address immediately, and that's your benefits administration. So there's been a lot of press and time spent on how can we reduce our plan costs, but what employers often miss is that there's another albatross of a cost that's sitting over your benefits plan, which is how much time and effort and money required to administer your current administration platform, which is oftentimes clunky, it's paper-based, requires a lot of manual work. So really what we've seen a lot of employers do is shift to a benefits admin platform, which essentially involves a fully digital enrollment experience for employees as they're onboarding onto the plan. No paper, and I'm including beneficiary designation in that. There's connectivity to multiple carriers, so it gives that employer some more flexibility in terms of bringing in the best in breed providers on the back end, and it generates a single bill. What a benefits admin platform also does is simplify the process of administering flex benefits and making them more accessible to employees. For those of you that have an HRIS platform, the experience is even more streamlined with HRIS data that gets pushed in to the benefits admin platform, which then connects to all your insurers on the back end. So there's some real dollar savings here. There's some real efficiency gains, and there's some really big gains in plan compliance here through adopting a benefits admin platform. So something I would encourage you to explore. What I want to do now is really shift focus and start talking about plan design considerations. Before I do that, I just wanted to offer a word of caution in that it's really important to avoid jumping into the tactical here before reevaluating what your benefit strategy is as a whole, so that you can align that strategy to the tactical considerations that we're going to talk about going forward. So one of the things I like to talk about with benefit strategy is, where does your plan fit in from the standpoint of health benefits versus health insurance? So how I like to describe this is basically managing employee wants versus employee needs. So on the health benefits side of the spectrum, 90% of your employees will gravitate towards these benefits. However, there won't be any financial hardship if you were to remove any of those benefits. So what sits in the health benefits side are benefits like vision care, massage therapy, health spending account to an extent. On the other side of the spectrum are benefits that perhaps less than 10% of your employees will ever have to utilize. But if those benefits weren't there, there would be tremendous financial hardship. So what I'm talking about there are benefits like long-term disability, accidental death and dismemberment, life insurance, and high-cost drug coverage. So the question to ask as an organization is, looking at your benefit strategy, where do you fit in on that continuum? If you're having some challenges trying to figure that out, I'd like to offer some quick food for thought. So if I came to you with a question saying, if you had to reduce your benefit plan to cut costs, would you rather reduce vision care, which is on the health benefit side, or would you rather reduce life insurance, which is on the health insurance side? Your answer to that will really help you determine kind of where in the continuum you naturally gravitate to. So let's jump into the spectrum of plan design considerations. So as I mentioned earlier, we're going to start here by talking to employers that require some immediate cost relief, and then we'll work our way into plan design measures that involve some greater investment in employee support. So let's talk about staggering dental and paramedical coverage to start with. Many of our clients during the COVID period temporarily removed dental and paramedical coverage to participate in greater cost savings. So something that I would suggest to consider for those employers is really to stagger their plan designs back to normal levels over time. So for example, for dental, perhaps starting with basic coverage only, which covers off things like cleanings, scalings, root canals, and periodontic work, and then bringing on the major coverage and the orthodontic coverage over time. For those that also remove paramedical coverage, you could start with a smaller subset of practitioners to limit exposure and even look at reducing the maximum to a combined maximum, and then ramping up the plan design over time. So even for those employers that didn't necessarily remove those benefits, what you could look at are some temporary plan design measures to try and smooth your claims experience out over a longer period of time. And that's particularly critical for those of you that are on an ASO plan, where you're really looking at the volatility financially month to month. So something to consider there. The other thing that we're seeing is really a shift towards preferred pharmacy. So if I came to you and said, if you could offer the same level of drug coverage to employees, but lower your cost as an employer by up to 15%, would you take it? This really ties into the strategy around how engaged should employees be in managing costs. What we're seeing here is that virtual pharmacy is really coming up to the plate, and it's filling the gap by offering social distancing, convenience, and lower cost to employers by directing regular pharmacy traffic that would normally go to a brick and mortar pharmacy into the virtual pharmacy. And this is where we're seeing the savings on the markup side as well as dispensing fee. So something to consider, but the question is, are you okay as an employer with promoting change in employee behavior to help drive those costs? The answer is really up to you. And then last but not least, I wanted to talk about traditional levers. So these are things that you want to talk to your advisor about in terms of lowering co-insurance, lowering maximums. You could use benchmarking to make sure that you're still aligned with where you want to be from a comp and benefit strategy, but you might have some leeway to be able to reduce some benefits, even if it's only temporarily, until things to ramp up again. So let's shift our focus now into areas that might require some greater investment in terms of employee support and benefit. The first one I want to talk about briefly is long-term disability. One of the things that we commonly find with long-term disability is there's a shortfall in benefit schedule and a shortfall in benefit maximums in the plan relative to what the salary distribution is for that particular employer. What this does is it leaves employees vulnerable with really big gaps in income if they're unable to work. And sometimes that vulnerability has led to liability issues for the employer. So that's something I would highly consider you to explore with your advisor. And most cases are employee paid, so it's not necessarily additional employer cost. The next thing I want to talk about is the return to work environment that we have going forward is really going to demonstrate the diverse needs of your employee group. So the question I ask you is, does your plan provide coverage for items like childcare or elder care, which could be funded through a lifestyle spending account? And you could complement that with an employee assistance program to help that employee with research on childcare and elder care facilities. So that's something to consider on employees coming back to the new normal. One of the biggest trends that we saw pre-COVID were employers that were recognizing that the $500 per year standard for the psychology benefit was simply not sufficient to provide adequate mental health coverage. So even prior to COVID, we saw a lot of employers increase that to $1,000 per year and beyond, with very minimal increases in their costs, but a very big message to their employees in terms of support. So that's something that we're going to see definitely ramp up in the period that we're in now, because what we started to talk to with insurers is that basically starting from the first and second week of March, they are already starting to see a material spike in claims of employees reaching out to utilize the psychology benefit within their paramedical services. So this is something to think about as an employer. How will you be there to support them with adequate support? And then finally, sticking on the mental health theme, another item that we're seeing get added is the addition of ICBT services, either to the paramedical practitioners as a whole or as a separate per employee per month cost. So the question you're probably asking is, what is ICBT? So ICBT is basically cognitive behavioral therapy that's delivered virtually. So cognitive behavioral therapy involves face-to-face counselor interaction. And basically what happens is the counselor leads the patient through questions and exercises. What happens with ICBT is that the therapist is still overseeing the process. However, the employee, through their app, it basically goes through the discovery process on their own. They deal with the questions, they go through the exercises on their own. What we've seen here is some really, really great results in assisting employees with areas like anxiety, depression, and in return to work after disability. So it's been very, very helpful to the point where the provinces of Manitoba and Ontario have already rolled out ICBT to all their citizens. So for those of you that have employees in those two provinces, you wouldn't necessarily need to add any employer-paid resources there because the provinces are already offering it. However, that may be something you want to support your employees in other provinces for. So leads me to two key trends that we're seeing as a whole in Canadian benefits. The first one, probably no surprise based on how the presentation has been going, is an investment, greater investment in employee mental health support, given the environment that we're dealing with. The second one is a real shift to virtual care services. So what I wanted to do here is kind of show you some data on ROI and workplace mental health programs that was delivered by Deloitte in November 2019. So interesting to note that the cost data here is from November 2019. What I would suggest is November 2020, when it comes out, will certainly be amplified because we are seeing a greater need for mental health support. So the question is, how will your organization prepare for that reality? This slide can actually be a full hour presentation on its own. What I really wanted to do here was identify the differentials between your employee support programs as well as manager training, which is really going to be critical in this new environment. It's really up to you to know your employees and figure out how these programs fit in. What I really wanted to do is kind of give you a landscape of what employers are doing. On the employee side, I really wanted to take your attention to mindfulness and resiliency programs, which are there both as a mechanism to offer coping and support, but also there's a performance component in there because if the more resilient an employee, the more mindful an employee, there is some performance enhancements there as well for them. The other piece is on stress management. Stress management is a key driver. It was already a key driver prior to COVID. That's only going to amplify now. So what sort of coping mechanisms and tools are you giving to employees and managers on managing that greater level of stress? One area I would suggest right away is the number one driver of stress in survey data that we saw prior to COVID was financial. And if you couple that with the low financial literacy that we're seeing in Canada, you're dealing with an employee that's now saying, I'm stressed about finances and I don't know what to do about my finances. So something you could do with very low cost is actually schedule some education sessions with your group retirement advisor and your insurer to kind of help employees ramp up their literacy and give them a sense and more control over what their finances are doing on the retirement side, at least. On the manager side, a couple of things I wanted to bring your attention to. Mental health first aid as part of your occupational health and safety. So I provided a link there to explore for greater resources on mental health first aid. But this is a very low-cost certification program to help equip your managers to identify employees at risk and actually direct them to get support. This has really been invaluable both to employees, but also to the managers themselves to give them confidence to know they have the resources to help out employees. And then last but not least, one of the trends that I also saw over the past year was a huge drive for employers to encourage emotional intelligence training for their employees. And I provided the longest URL on the planet, workplacestrategiesformentalhealth.com. It's a great site. And why I like to direct employers to it is that it actually has a free emotional intelligence assessment, as well as some tools for managers to work on the items that they come up short on the assessment. Highly encourage you to check it out, and it's free. So it's actually a really valuable resource. And then last but not least, wanted to talk about the shift to virtual health. So Virtual health really involves employees having a doctor, psychologist, and pharmacist visit accessible through their mobile app. This has been on the periphery for the last decade in Canada, but in the last 2 months, it's really becoming a staple. So this is something I would highly encourage you to explore. In fact, a number of insurers are already embedding virtual care services into your plan, free for a limited time. However, there will be charges when you get to a renewal. So it's important to talk to your advisor about, A, can you budget for those charges? And B, if there's an opt-out clause if you can't budget for those resources. And with that, I just wanted to thank you. So we've covered a lot of ground today. We've talked about benefits budgeting, ways to save money, the spectrum of plan design, and the trends in mental health and virtual health. Thank you for taking part in the Canadian Benefits 2020 and beyond, and for sticking with me throughout. My name is Faisal Mitha. Stay well, stay healthy, and we'll talk.